My name's Janette Irving. I'm currently working as a community matron for adults with a learning disability based at Waddiloves Health Centre in Bradford. Well, starting from the beginning, when I was at school and I had a part-time job, I met somebody who was a volunteer at Westwood Hospital, which is in Bradford, and she went on a Sunday to one of the wards to be a volunteer and help with the children that live there. So she invited me along, so I went along in 1976 to be a volunteer on a ward at Westwood Hospital. I only went for four Sundays because at the time I became very upset because it was a new thing to me. I'd met people as the term was mental handicap then. I'd met people with mental handicap, but I'd never been to somewhere where people lived. And the ward I went to live on, they were young, so they were younger probably than me and about my own age, and lived on a ward. There were about 30 people lived on the ward with nursing staff, and they were called nursing assistants at the time who helped. And as a volunteer, we were allowed to bath people, we were allowed to feed people, and we were able to take part in some of the things that were going on the ward, but the main things that were going on was looking after people, was the personal care. And from then on, I then went to work in a library for 2 years. I was going to be a librarian, but there was always an inkling in me that I wanted to go back. So when I was working as a library assistant, I saw a job advertised as a care assistant for social services, and I got that job, and I went to work in a special care unit, which was based up at Leeds Road, and that I stayed there for 12 months. And the manager at the time told me that said I was too young to do any training. That he felt the other staff should have that opportunity, but he felt that my skills should be utilised, and he pushed me into looking at nurse training. So I went to look at what nurse training for people with a learning disability was about, and I applied to Leeds, Manchester and Halifax, and I went for interviews in all the three places to look at being a student nurse for people with a learning disability. But at the time it was called mental handicap. It was to be a registered nurse for people with mental handicap, and I accepted the student place in Leeds at a hospital called Meanwood Park, and I worked at Meanwood Park as a student nurse for 3 years, and then worked there as a qualified nurse for a year on the wards at Meanwood Park. And then I went on a conference down south. I was sent on a conference, and it was about staffed group homes. So when I came back from the conference, on the ward we put together 4 ladies that we thought got on really well, and we started doing simple tasks like opening a tin of soup, making a small meal, making their own drinks, setting tables, doing some washing, doing some ironing, things that they didn't usually do on the wards. It was all done by a laundry service. Meals were always delivered. And then I saw a job advertised in Bradford, based at Westwood Hospital, and it was to work in a rehabilitation unit, and I came for an interview. There were 2 houses, and in each house there were 4 people, and there were a group of people that were chosen from wards within Westwood, and they went to live in the group homes, and I worked there for about 18 months, and saw that group of people successfully move out into group homes out in the community. And then unfortunately then I had to go back and work on the wards because of personal reasons, and I worked on the wards at Westwood until 1990. Worked on 2 wards. One of them was was classed as a children's ward, and the youngest person who lived on the ward was 14. And then I saw a job advertised for a community nurse, and that was a fairly new venture. It was called the Community Team for People with Learning Disabilities, and I was successful in getting the job as a community nurse, and it was working with social workers, and it was working with people who lived either at home with families or people who lived out in usually local authority establishments. Some of they were called hostels at the time, and usually about 20-25 people lived in the hostels. and our job was about making sure that people's needs were met, social needs as well as health needs. And then after that, in 1995, I moved to working with some day services, and I worked with some day services for people who had left Westwood, because at that time Westwood had closed and people were living out in different establishments but needed some particular day services. And at that time my job was about promoting our services to encourage other people to get funding and come to the services. And I had a brief spell working with local authority, managing some respite services for one of the local authority managers. And then I came back to community nursing, where I stayed until 3 years ago when we set up the team that I'm in now, and I applied for that job as the matron, which is where I've come to now.